Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, December 15th, 2021. As the year ends, I'd like to take this opportunity first to thank Minister Haggie, Dr. Fitzgerald, and the whole team at Public Health for doing an incredible job in keeping Newfoundlanders and Labradorians safe. And the same goes, frankly, for all of you at home who've done your part, stepped up, got the vaccine, followed public health measures, and led the country in many ways in keeping us all safe. Thank you for getting vaccinated, for making sure that your children are getting vaccinated, and for quickly using the NL Vax Pass, recognizing the importance of taking public health advice seriously to protect not just you or your loved ones, but indeed the entire community in the province. By being vigilant, we can still enjoy a safe and happy holiday season, albeit still different, but safe. I know that's what I want for my family, and I know that's what you want for yours. I also know that people are very worried. We've been through a lot in the last 2 years, and we're afraid of what might come next. But please, take a deep breath, take a beat. We're going to be okay. To the people of Deer Lake, part of my district, a beautiful Humber Gross Morn, please know that we are all focused on managing the situation of COVID-19 right now, and thank you for doing your part by isolating and getting tested as directed. And a special thank you to the Mayor and the Town Council, with whom I've worked very closely over the last few days. On that note, Omicron is certainly going to require that we make some adjustments here at home. That is what living through a pandemic is. We've seen it in the past, and we've done so in the past, pivoting when needed. And in Newfoundland and Labrador, we've always done that well. We're seeing it spread across the country and around the world, and we're seeing swift action as a response. It certainly is highly transmissible, and we, like other provinces, are reflecting on our current public health measures. In some cases, provinces are making changes to bring them in line, actually, to where we already are. And thanks to our prudent public health measures and careful reopening plan, we are in a decent spot. Last night, I joined my fellow premiers on a call with the Prime Minister to talk about the variant and our country's response to it. The federal government may tighten international border restrictions, and it is supporting provinces with booster doses, rapid tests, and additional funding to tackle Omicron. We're all in this together, and our friends in Ottawa are there to support us. Now, while some of the evidence suggests the variant does not make people as sick as other variants, and that 2 doses of the vaccine does still provide some protection, it has been shown to be more resistant to vaccines in general. So a booster shot will help even more. My friends, this is the single biggest thing we can do, and we are in a better position than most provinces with respect to vaccines, so let's continue to lead the way. I have to stress, once again, vaccines are certainly effective, much more effective than no vaccine whatsoever. First off, we are able to offer boosters to everyone over 18 and older 24 weeks after their second dose. Different from last year when the vaccines started, these are widely available in pharmacies now. And sometimes you don't even need an appointment. So I please encourage you to use the pharmacists and pharmacies to inquire about how you can get your dose. Your vaccine record, whether it's on your phone or in paper, shows when you got your doses. So you should be able to do the calculation around the 24 weeks. Along with the booster shots, we will be providing rapid tests to people arriving in Newfoundland and Labrador over the coming days. As we have always said, COVID-19 is as fluid, dynamic a situation as we're ever going to face. What didn't make sense a month ago may very well make sense today as the evidence changes, as the virus changes. So we are working through the logistics and feasibility of using rapid testing here in the province, and we'll share more information on that as soon as we can. But that's my main message to you today. Please, take a breath. Don't panic. We have many tools in our toolbox to tackle this variant, just like we have others. And we have one of the highest vaccination rates in the world. Get vaccinated, wear a mask, follow public health guidelines, and trust the best evidence available from the experts. Not every online source is an expert, so please follow the advice of experts. With that, now I'll turn the mic over to our expert, Dr. Fitzgerald. Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us. Since the last media advisory, we have 13 new confirmed cases in the province. 1 is in Central Health and under investigation. 3 are in Eastern Health, 2 are related to travel, and 1 is contact of a case. 9 are in Western Health, and all are contacts of a case or of cases. There are also 8 new presumptive cases in Western Health. There have been 2 new recoveries in Western Health, leaving us with 34 active cases in the province. The total number of COVID-19 cases for our province so far is 2,106. No one is hospitalized from COVID-19. 773 tests were completed since yesterday for a total of 354,535 to date. We have just received confirmation of our first case of Omicron in the province. The person traveled from elsewhere in Canada and is in Eastern Health. They have been isolating since their return to the province, and public health does not anticipate any onward spread. We continue to monitor the evidence emerging on this variant. It is a much faster moving virus than Delta. It spreads more easily from person to person. And while Delta is still the predominant strain in Canada, it is likely only a matter of time before Omicron replaces it. This is the pattern we are seeing in other countries, such as in the UK. Omicron disease severity and vaccine effectiveness against Omicron are still being investigated. Most cases to date are associated with mild illness. Hospitalizations often lag behind infections by a couple of weeks, so we still need to interpret this information with caution. Some early studies indicate that the vaccines may help to prevent severe disease, but we still need more time to see how this variant will behave in the Canadian population. Our key concern around Omicron right now is its transmissibility. It has the potential to infect large numbers of people in a shorter period of time. If that comes to pass, it's difficult to predict what the impacts will be in terms of disease severity and what level of pressure it will put on our health system. Nationally, the COVID epicurve is trending upwards, once again, primarily due to Delta. But nationally, 28,675 new cases were reported this week, an increase of 30% compared to the previous week. Several jurisdictions are increasing restrictions in response to community spread of both Delta and Omicron, and we have been fortunate here in Newfoundland and Labrador to have favorable epidemiology and very few restrictions. We have a window of opportunity to avoid or delay the same pattern that other provinces are experiencing. And the last thing anyone wants is for COVID to take hold in the midst of the holidays. In response, we are introducing additional testing requirements for travelers. Effective immediately, anyone returning or who have returned from post-secondary institutions elsewhere in Canada or internationally will be required to have a PCR test upon arrival to the province. Student travelers can book a PCR test through the online assessment and referral tool on our website. If these students opt not to be tested, they will need to isolate for 14 days. In the coming days, as the Premier mentioned, we will provide all travelers with a package of take-home rapid test kits to screen for COVID-19. Unvaccinated travelers will still be required to quarantine and test as they have previously. We are also putting extra precautions in place for those who are most vulnerable. A maximum of 2 people at a time will be permitted to visit their loved ones in long-term care or personal care homes. These can be different people for each visit, and we will continue to monitor epidemiology closely and introduce further measures as needed. We have the best vaccination rate in Canada, which should serve us well in the months ahead. Approximately 92% of our population is fully vaccinated. The early evidence on Omicron shows that a 3rd dose offers better protection than a primary series alone. Following guidance from the National Advisory Committee on Immunization, Newfoundland and Labrador is offering COVID-19 booster doses for anyone aged 18 years of age and older when at least 24 weeks have passed since the completion of their primary series. So for most Newfoundlanders and Labradorians, this will be after your 2nd dose. Due to the pediatric vaccination rollout underway, people ages 30 years of age and older are encouraged to get Moderna vaccine as their booster by contacting their local pharmacy, physician, or nurse practitioner. NACI has recommended that individuals aged 18 to 29 receive the Pfizer vaccine for the booster dose. Anyone in this age group will need to get their booster dose at a public health clinic, as Pfizer is only available through these clinics. If you are eligible for a first dose, a second dose, or a booster dose, please take the next important step and make the time to get vaccinated. If you are a parent of a child age 5 or older, please make the choice to vaccinate your child. If you have any questions, please speak with your family doctor, nurse practitioner, or your school's public health nurse. In less than 2 weeks since the start of our pediatric immunization program, we have administered first doses to about 52% of children aged 5 to 11 in our province. This is very encouraging. The news of the Omicron variant is certainly not what any of us wanted, and especially at this time of year. Once again, I have to advise caution as we prepare to welcome family and friends home and celebrate the holiday season. Remember that we have the tools and the power to reduce the risk of Omicron. The same tried and true public health precautions that have become second nature to us are still needed. Wear your mask in indoor public spaces. Keep your contacts low. Remember 25 for personal gatherings. Distance from those that are not your close contacts. Wash your hands well and often, or use hand sanitizer. And most importantly, make the choice to be vaccinated. We are all in this together, and we have proven time and time again we will succeed when we all work towards a common goal. So we got this. Hold fast, Newfoundland and Labrador.
Oh, thank you, Dr. Fitzgerald. I'll now invite some brief comments from Minister Haggie. Minister?
Thank you very much, Premier. Omicron has travelled here. It was really only a matter of time, and we've talked about life with COVID rather than avoiding COVID, and that's been the way we've dealt with this for some time now. This is the latest of the variants of concern. It's the third we've seen. We've been here before. We've done this before, and I know everyone's tired, none more than some of the people around this table and the people in the community who've had to live with it. But the fact of the case are, we need once more to remember that we have tools now that we did not have before. And not to forget also the public health measures which have served us well from the beginning. The only constant around COVID has been the need to change over time. But we are in a different place. I was reflecting today that it's actually a year ago today that the Premier and I stood on the tarmac at St. John's International Airport when the first vaccine doses actually arrived. Since then, as Dr. Fitzgerald says, we've got over 92% of Newfoundlanders and Labradorians fully vaccinated. And in less than 3 weeks, we've got 52% of our youth vaccinated with their first dose. Boosters again, NACI has altered their recommendations to move up the eligibility for the second dose. The system the healthcare system is ready to deal with what may come. We've heard Dr. Fitzgerald's measures about long-term care and protecting our seniors. We just need to moderate the number of visitors there at any given moment, still allowing family who've come from away to visit as long as they meet the vaccination criteria. We have looked at our surge plans. We have more ventilators than we have ICU beds, and currently only 10% of those ventilators are actually in use. We're looking at making sure our COVID units across the island and into Labrador are available should they be needed. But as Dr. Fitzgerald also pointed out, we have nobody hospitalized, and indeed in the last wave during the winter, the hospitalization numbers were small. Since then, the only group that required hospitalization have been those that weren't vaccinated fully. Contact tracing capacity is under review. We have a tiered approach to this, and we believe we can rise to the challenge. Public health measures continue to be a mainstay, but on top of that now, as Dr. Fitzgerald says, we need to make the time and we need to get the shot. So with that, Premier, I'll turn things back over to you.
Well, thanks, Minister, and I'll now invite questions from the media.
Thank you, Premier. Today we have 3 media attending in person and 4 joining by phone. The first round of questions and answers will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask one final question. Our first questions are from Glenn Whiffen with The Telegram. Glenn, please go ahead and make your way to the mic.
Okay. Now that we have our first case of Omicron, what measures or adjustments to measures are being made right now, and what do you anticipate in the coming days and weeks?
At the moment, we have, shortly we will be rolling out testing at points of entry for people, well, not at points of entry, but we'll be handing out tests at point of entry for people. These will be self-tests that people will be able to do to screen for COVID-19, and there'll be instructions with that for how to use them. But the thought behind it is that they will take that test on a regular basis every day and to screen for COVID. These are best used when we use them in succession and much more accurate in that situation. Right now, we're looking at our vulnerable populations with long-term care, as I said, and just limiting the number of visits at a time. We've had some communications to go out to long-term care to talk about, just reinforce those measures that we've had in place, which we have in place right now. There's masking, people have to be vaccinated to go in. We have our VaxPass in place, we have our high vaccination rate. We're looking at the alert level system right now and seeing how we can, or what triggers we would need to move from one level to another, and just if any modifications need to be done to that in view of our high vaccination rate and our use of the VaxPass. So all of those things we're working on, and hopefully we'll have more information in the coming days.
Regarding Western Health and the new cases there, can you tell us how many communities, how many schools are affected?
Yeah, just 1 second now. Sorry, I have to pull it out, had to take notes. So right now we have 36 cases connected to that cluster in Deer Lake. Public Health is still really focusing on doing that contact tracing, and so a lot of the questions about connections, I don't have the answers to those right now. We do know that we have the majority of cases in Deer Lake. There are some in Corner Brook and then some in the communities surrounding, but once again, we don't have all those connections in there. At the moment, there are 4 schools, to the best of my knowledge, that have cases. And others may be impacted with contacts, but to the best of my knowledge, that's where we are right now.
But just to be clear, that's not, in case anyone is concerned in Deer Lake, to our knowledge, that's not a new variant.
Oh, no, this is Delta. It has been confirmed that's Delta.
Just for clarity. Yeah.
Our next questions are from Peter Cowan with the CBC. Peter, please go ahead.
Thank you. Over the last almost 2 years of the pandemic, there have been lots of questions about doing point-of-entry testing. Up until now, you've said that it's not effective. Can you give us an idea what's changed your mind, and why do you think now is the time to start doing this when it wasn't before?
So I think at this point we have done point-of-entry testing before, but at this point, I think, we have a variant that's spreading more quickly. Its incubation period appears to be a little bit shorter, around 3 days. So we want to catch those people as they're coming in. We feel it's important to try to get that information as quickly as possible. We know that it spreads more easily, so having people wait to get tested with PCR is not necessarily a feasible thing to do. And we have people who are vaccinated right now, so we don't want to have to isolate people who are fully vaccinated, and so choosing to go this route allows us that. I guess it's the balance between reducing the risk and not reducing mobility as much as possible.
We've seen experts across the country have talked about using rapid tests, especially going into the holidays when people are going to be gathering in groups again. People are going to be traveling to different parts of the province, for example. Nova Scotia has made lots of rapid tests available. You can pick them up in libraries and even the liquor store. Why aren't we making rapid tests available for people who maybe a little bit worried about getting together with Nan and other close family members and want to just make sure if we get everyone tested, then we know at least right now we reduce the chance that we spread it at family gatherings over the holidays.
Yeah, so that's a good question. And what we have to remember about these tests is that they're very much affected, their results and their reliability are very much affected by the prevalence of disease in the community. So if we're talking about places like Ontario right now, and even Nova Scotia and New Brunswick, where we're seeing a fair bit of spread, that's a little bit of a different story than where we are. And so, that risk of finding or having a false negative is a little bit higher, and having a false positive, in fact, is a little bit higher when you have a low prevalence. So we certainly are looking at doing self-testing, and we're considering how we can best use it. And we're developing a plan for how we will be able to use that. So, I think we'll hear more on that in the coming days, but and we are planning on using it at the border for screening. So it's something that we're looking at very closely and trying to see how we can best use it to get the answers that we need, and to be as feel as comfortable with those results as we can, so that it gives us the best information we can. It can.
Our next questions are from Michael Connors with NTV. Michael, please go ahead and make your way to the mic.
So the PCR test requirement for university students, I guess, why just university students, not everyone else? And do you foresee eventually these things expanding back, say, to rotational workers and other travelers to the province, and even evolving back into, say, an Atlantic bubble or something like that?
Yeah, so I think Atlantic bubble is kind of off the table right now. But certainly what we've seen and what we're seeing across the province is that we have had outbreaks in several large university populations. And so we know that there have been events that have happened, and people have come to a university and then have gone back, and so it's spread to other universities. So we feel that there's a fair higher risk with that group, and so we're recommending PCR because we feel the risk is a little bit higher. So we want to make sure that we're getting the best test to answer the question we need answered. And with regard to expanding PCR testing, I think at this point we're sticking with the rapid test for people to do self-tests. We have to also consider what our capacity is for PCR testing. We have to reserve our capacity for surges, so that's a very important thing. And we want to make sure that we're able to respond if we need to. So, it'll be a combination, I think, of self-testing and PCR testing is the way that we respond to this. We also are waiting to see what the federal government is going to require of international travelers, and, we may have to make some decisions around that.
You've also, and we talked a bit about this on Monday, but I guess I want to revisit it because you talked about the importance of the third shot now with Omicron. We've had this kind of 90% threshold for first and second doses. Is there a 90% target you're now trying to achieve for third shots, and will that eventually become part of the definition of fully vaccinated?
So obviously, yeah, I'd love to see booster shots at 90%. I mean, for us in public health, as high as you can get vaccine rates, that's where we want to be. Right now, our definition of fully vaccinated still includes 2 shots. And as I said on Monday, our definition of what's a primary series may change with this vaccination at some point down the road. And that's not unusual that we see that. It's happened with other vaccines in the past. So, but, we need lots of evidence, lots of experience with the vaccine before we can make some of those decisions. So right now, things are as they are. Fully vaccinated is 2 doses. A booster is at that 24-week mark. As time goes on and we get more information, I guess we'll have more information about that question particularly.
Our next questions are from Richard Duggan with VOCM News. Richard, please go ahead.
Thank you. In regard to the cases on the West Coast, are all those cases linked? Is this a cluster?
So we, at this point, I can't say if all of the cases are linked. Certainly we know that many of the cases are linked, and there are many of these cases that are contacts of cases, and that's how we found them. There are some who have no known source of infection who do not appear to be linked to anyone else. So there certainly appears to be some community transmission in that area. You know, public health is working very hard to find those people and to get them tested. But whether they're all linked at this point, you know, it's very difficult to say. There's a lot of work being done on the ground at the moment, a lot of people being interviewed, a lot of contacts being notified.
And I've heard from quite a few people now who say that they're having a lot of trouble booking their booster shots. What sort of backlogs are you hearing of with this, and what's being done to mitigate it?
First of all, don't forget that pharmacies are available. I think different than where we were this time last year, where people were booking just exclusively for one site. There are ready and willing and able pharmacists and pharmacies out there to mitigate the backlog at one specific site or two specific sites. So that's one thing. But I don't know, Dr. Fitzgerald, if you have any further.
No, I don't have any specific update about difficulty booking appointments. So for those who are over 30, definitely, or 30 and over, we definitely recommend that you check with your pharmacy physician or nurse practitioner. But pharmacies do have lots of vaccines. Pharmacists have been instrumental in our flu vaccine campaigns in the past, and certainly throughout COVID, they've been a very important point of vaccination for us. So we certainly encourage everybody to get out there and get their vaccination at the pharmacy if you're 30 and above. For those who are under 30, so 18 to 29, then the recommendation is that you receive Pfizer, so you will have to book through the clinics. And, you know, sometimes if appointments get booked up really quickly, then you may just have to keep checking back. Minister, I don't know if you have anything else to add to that.
Yes, thank you, Dr. Fitzgerald. We've had no complaints in the department specific about booster shots. We are aware that it's an online booking process for the public health clinics, and it may well be simply that people have found it difficult to get one where they want it, when they want it. There are appointments to be had. I would echo comments made by my panelist colleagues that pharmacists are perfectly able to deliver Moderna, and I'm not hearing of any challenges there. I was talking to shoppers, for example, in Gander, and they have a steady flow of people, and they're not aware of any issues, or didn't bring any to my attention when I was there.
Our next questions are from Renella Grow with All Newfoundland and Labrador. Renella, please go ahead.
My question is for the Premier. When you spoke with the Prime Minister last evening, did travel restrictions come up? And what was discussed? Could we be facing any restrictions before or during Christmas?
So the Prime Minister briefed all the premiers on travel and conceptually where his thoughts were in terms of potentially limiting international travel. And I believe he has an announcement in the next 2 hours, if I'm not mistaken, to confirm those details. But conceptually, they were around international travel and potential restrictions around that, and recommendations from a public health perspective and from a foreign travel perspective.
And I'm just wondering how the vaccination process is going with our children and young people and the rollout in schools. How are things there?
It's going very well, I think, 52%. My kids got it. It was great.
Yeah, so I don't think there's been any major concerns. Unfortunately, you know, snowstorms have put the best laid plans aside in some schools, and things have had to be rescheduled. But other than that, I think things have been going well. and we're getting good turnout at both the schools and in our mass clinics. So the fact that we're at 52% at this point, I think, says, you know, just over 2.5 weeks, I think it is.
It's incredible.
Yeah, that we've done a really good job. Kudos to our immunization teams who are just working like crazy to get this done.
Our next questions are from Roger Bill with the Shoreline News. Roger, please go ahead.
Thank you. I'd like to follow up on a question Peter Cowan asked about rapid test kits. In Nova Scotia, 400,000 kits were given out in 2 days this week through their libraries. They expect to repeat that next week with another 400,000. So is the issue here that is there some obstacle to Newfoundland and Labrador doing that, or is rather still trying to make a decision about whether it's helpful?
It's following the science.
Yeah, so we're in a bit of a different situation right now than Nova Scotia is from a prevalence point of view. And when we're using these tests, we have to take into consideration the prevalence of the disease in the population, because that affects what we call the sensitivity and specificity of the test, which influences how much you can actually rely on the result that you get from that test. So, we want to make sure that when we're using this test, we're getting and giving people are getting the best information that they can at that time, and that we're using it to protect the population to the best extent possible. So you do have to take into consideration the situation, the provincial or jurisdictional situation, I guess, before you make a decision about that. But, once we have something in place and we decide we need to use tests in that regard, then we'll be ready to do that.
Second question, I'd like to ask you your comment about something that the Chief Medical Officer of Health in Ontario said in a briefing they had yesterday. He said two things that struck me. One is he said about Omicron, he said game changer, and he said urgent. Would you concur that it's a game changer and there's an urgency about this?
Well, I think, it certainly has changed how we have to look at things. It's more transmissible, and it is rising rapidly in those jurisdictions where it has taken hold. And I think, as I said earlier, if you have something that's highly transmissible, and if a lot of people get infected from it, even if it's causing mild symptoms, it can still put a certain percentage of people in hospital. It can still make a certain percentage of people severely ill. And the larger that number is, obviously, the more people that will be. So I think from that point of view, there is some urgency to make sure that we are, taking this seriously. But it's not just for us in public health, it's for everybody. We need to realize that we are dealing with a more transmissible virus, and that we all have the tools and the ability to help reduce the spread by doing all of those things that we've been doing for so long: wearing our masks, keeping our distance, washing our hands, staying home when we're sick, and getting vaccinated.
Our next questions are from Patrick Butler with Radio Canada. Patrick, please go ahead.
Hello. This morning I was speaking to both Marine Atlantic and the St. John's Airport Authority, who weren't aware of these new upcoming rules about rapid tests. I'm just curious when the target is for actually bringing this in.
So the target is later this week. Could be over, towards the end of the week into the weekend. And there's just a few logistic things to be worked out.
And we're hearing about some long wait times on the West Coast and the Deer Lake area for testing for people who could be close contacts related to this outbreak. Has there been any capacity added in terms of testing in that area of the province?
Yeah, to the best of my knowledge, they have set up a clinic in Deer Lake, and so they certainly have looked at that. They're also exploring how to use more rapid tests in that area, as we have used in other outbreaks in the past, to try to speed that queue up. So hopefully over the next day, we'll see some improvement in that.
I will now go back through each reporter to see if you have one final question. Glenn Whiffen with the Telegram, do you have any final questions?
Yes, I do. Premier, in the meeting with the Prime Minister last night, what kind of supports were mentioned for provinces, and was there anything specific for our province?
In general, the Prime Minister was very supportive of all actions being taken by provinces, recognizing that the epidemiology is different, of course, in different jurisdictions. The vaccination rates are different in different jurisdictions, but supportive in general of making sure that there's a robust supply of vaccine, that there's certainly availability of rapid testing kits when there are to be deployed. So nothing specific to Newfoundland and Labrador, but in general, very supportive of every province and territory, frankly, in their efforts as we fight this together, because this is a variant that is going to cross all jurisdictions. There's no question about it, and we need to approach it together. And he was, I think all the premiers recognize that, and we're all supportive of his measures as well.
Peter Cowan of the CBC, do you have a final question?
I do. The latest science, and I know this is changing, it seems, by the day, about Omicron shows that 2 doses is much less effective at protecting against initial infection. Since that means that it's more likely now that people who are fully vaccinated will still be able to get the Omicron variant, why aren't we bringing in more border measures, for example, going back to some sort of isolation requirement for people coming into the province, even if they are fully vaccinated?
Yeah, so at the moment, that's one study. I mean, certainly we know that, that concern about the vaccine not being quite as effective has been there since the beginning, knowing how many mutations this variant had. And at the moment, we know that it appears, that same studies appeared to show that there was protection against more severe disease and hospitalization, or at least hospitalization, I should say. At this point, we're still waiting to get more information. Certainly testing at the border, testing will pick up people. So, that's the most important thing, is that we find people. And, we have brought in vaccinations with the hope that we can improve mobility. And until we know that we can't do that, then I think we have to allow that to happen. And I don't know that anyone wants to go back to closing our borders down again, or having, long isolation periods. So time will tell, as we've always said. If new information comes out, if there's more information that tells us we need to act in a certain way, then, we've never hesitated to do that before, and I think we would again. But, we've learned a lot over the past 2 years, and we want to try to be able to handle this as best we can, while reducing societal disruption to the greatest extent possible.
Michael Connors of NTV, do you have a final question?
Back in March, Dr. Rahman had said there were no excess deaths in the province last year. Statistics Canada has been putting out numbers on this, and about a week ago, CTV posted a graphic online for Newfoundland and Labrador, and if you added up the numbers, it seemed to show there had been 200 excess deaths in the province, mostly recently since then. Can you explain the difference there, or have you done an update on numbers of excess deaths in the province and what they would be attributed to?
Certainly, we haven't done an update that I'm aware of, but we're happy to revisit that with Dr. Rahman, and I'm not familiar with the data that you're suggesting, so happy to have a look, and happy to have a more detailed answer for you after we do.
Yeah, I haven't seen what you're referring to, so I don't know that I can comment really.
Richard Duggan with VOCM News, do you have a final question?
Yes, coming up now on Christmas week, lots of people will be wanting to head to church for various services. Does that pose any particular concern given the Omicron variant, and are you considering any possible restrictions?
At the moment, our restrictions are there. You have to wear a mask. I guess it depends on the church as to whether or not the Vax Pass is used, but people, if they are using a Vax Pass, then everybody will have to be vaccinated, and if not, then physical distancing has to be maintained. So, at this point, we have not made any recommendations to change, but as I've said previously, if we see that there's changing epidemiology and that we need to do that, then we will make those recommendations. And as as we've done many times in the past.
Renelle LeGros of All Newfoundland and Labrador, do you have a final question?
I'm good. Thank you very much.
Roger Bill of the Shoreline News, do you have a final question?
Yes, I do. Premier Furey, during the election 9 months ago, you told a media briefing on COVID briefing on March 3rd that you saw that the light at the end of the tunnel was brighter. You saw a reason to be optimistic. I think most people feel like the end of the tunnel feels further away today. And I just wonder what lessons you've learned about predictions in this pandemic.
Yeah, I think if you've seen many of the other things that I said, that there's only one thing that's certain, and that's the uncertainty in this pandemic as well. But I would not argue, but I would suggest that we're in a much better place today than with 96% or almost 96% with one dose, 92% with two doses. I think that is significant progress in the tunnel with respect to COVID-19. When you're looking around the world and at other jurisdictions, I mean, they just don't have that. And even with the breakthroughs, you look at the absolute numbers and how they would play out in their jurisdictions. We're in a different spot. Is this a bit of a hiccup? Yes, but I mean, this COVID-19 is always going to be, I think, predictable. Not to make another prediction, but it's going to be with us forever, and it's going to be something that we're going to have to learn to live with. And this is an adjustment along the way, but I still maintain my optimism moving forward, given the vaccines and how effective they are, and certainly how perhaps a booster or whether that's the completion of a primary series of vaccination will serve us well.
Thank you.
Patrick Butler of Radio Canada, do you have a final question?
Yeah, it's related to access to booster shots or to booking appointments. Right now, if you go on the government's portal, you can't book a booster shot if you're in the St. John's area, for instance. Can you explain why that's the case, whether that's going to change? And also, we've seen a little bit of movement perhaps on interval between doses, the second and third dose. Certain provinces talking about maybe reducing it to 5 months. Is that on your radar right now?
So with regard to booking, I think appointments, as I said, if you're over 30, try the pharmacy or your physician or nurse practitioner. And if you are under 30 and you need to book a booster dose, certainly check back. I mean, you know, the RHA's paint out clinics so far, and if all the appointments get used, then they have to put more in there. So it may just be a matter of having to go back and you know, at a later time to get the appointment. With regard to the 5-month interval, as we've always done, we have taken NACI's recommendations with regard to vaccinations from the very beginning when they recommended that we increase the interval. You know, we took the recommendations with regard to booster dosing, third dosings for immune compromise, and that's what we've always done. So we will be following what NACI has recommended, and you know, as they review the evidence, they will make recommendations that they feel are necessary. They haven't steered us wrong to this point. It's our national body with, you know, the expertise that was really needed to look at all the evidence that's out there, and they've done a great job up to this point, and I think we'll continue to listen to them.
Thank you, everyone. Premier, do you have any final comments you'd like to make today?
Yes, thank you everyone for joining us. I know this is certainly not the position with new news of a variant, and certainly on our shores that people wanted to hear heading into Christmas. But please take a deep breath. Don't panic. Be calm and be kind to those around you, and we will get through this as we've gotten through the previous variant. So thank you for joining, and happy holidays.